Thank you, Mr. Chairman and Ranking Member DeGette, and thanks for holding this important and timely hearing on the nation's healthcare system and for the opportunity to be here to testify today. I represent Montgomery and Prince George's County, right outside of Washington, D.C. Even in my congressional district, close to the nation's capital, there are thousands of people who go without health care every day. I was honored to preside over the passage of the Affordable Care Act in the House and filled with pride, actually, to witness President Obama sign the landmark bill into law. Although the health care reform law has faced some opposition from some, I'm proud and steadfast in my support of the Affordable Care Act and the preventive care, the primary care, the community-based care, and the quality care that will now be received by millions of Americans. Before the enactment of the Affordable Care Act, our healthcare system had been failing a large part of our population who most needed insurance coverage. In a national survey, 12.6 million non-elderly adults, 36% of whom tried to purchase health insurance directly from an insurance company in the individual market, had been discriminated against because of a pre-existing condition just in the last 3 years. With a federal high-risk pool, these Americans will have access to a critical program that provides life-saving health care coverage. And the Affordable Care Act also encourages and enables people to seek out care sooner, saving the system money and increasing the chance of positive outcomes, health outcomes in the long run. That we should look to as very encouraging. I worked with my colleagues, and I was interested to hear you, Mr. Chairman, particularly Jen Schakowsky, in championing a provision that holds insurance companies accountable for excessive premium increases. That ensures affordability for working families who have health care coverage, but for whom costs are skyrocketing. In my congressional district, the provision has already helped protect 190,000 residents from price gouging by requiring health insurers to post and justify the increases of 10% or more. This is true all across the country in every single congressional district. At this important 2-year anniversary for constituents in my district and throughout the country, health reform has already delivered important and tangible benefits due to a number of provisions in effect today. I'm proud that our system would allow me the option to keep on my health insurance policy my 23-year-old up until age 26 in the event that he doesn't receive coverage through an employer. I visit senior centers regularly, where seniors now understand that the Affordable Care Act strengthens their Medicare benefits by closing the prescription drug donut hole and expanding coverage, all while lowering costs to them. Under the expanded benefits of Medicare, seniors can receive annual physical and preventive screenings. And the small businesses in my district and all across this country have received the benefit of a 35% enhanced to 50% tax credit in 2014 to help them as employers cover the cost of premiums paid to insure their workers. And with the filing deadlines approaching, employers should look for that credit on their return. And for women, and I am proud that for women all across this country, the Affordable Health Care Act has had a remarkable impact on their ability to finally obtain affordable and comprehensive coverage. According to the Commonwealth Fund, when the law is fully implemented, nearly all the 27 million women in this country, ages 19 to 64, who were uninsured in 2010, will gain health care coverage that meets their needs at a fair price. By 2014, health care reform will keep insurance companies from denying women coverage due to pre-existing conditions, like experiencing domestic violence or pregnancy or even acne. What a shame that we needed a law to ensure that insurance companies would not penalize women for those or other conditions. But you know what? I'm happy we have that law to do exactly that. And further, as members of this panel, male and female, know the act of choosing a doctor for your health needs an important and a personal decision. It is an important and personal decision. The Affordable Care Act ensures that women are able to choose any doctor they trust without a referral. As if insurance companies didn't have enough influence over the health care decisions of women before the passage of the Affordable Care Act, insurers could also choose to charge a woman more for her insurance policy just because of her gender. The National Women's Law Center reports the practice of charging women more than men for the same coverage costs women $1 billion a year with little evidence to explain the difference. And now, with the Affordable Care Act in place and scientific findings of the Institutes of Medicine, women will receive a full range of preventive services at no cost, including mammograms, colonoscopies, Pap tests, as well as well-woman visits, HPV testing, contraceptive methods, and support for interpersonal and domestic violence. To date, 20 million women have accessed these free preventive services. And for minority women like me, who too often go uninsured, the Affordable Care Act will provide equal access to health care and close health disparity gaps that plague women in underserved communities. And so I appreciate the opportunity to be here today to celebrate the good news of health care delivery for the American people through the Affordable Care Act. And I thank you. And I'm happy to answer any questions.